Hey everybody, welcome to Veritas Wellness. Thank you for checking us out. Our goal is to educate you and help you understand the root cause of disease, to both reverse disease but also prevent disease. My passion now is to teach, and the reason my passion is to teach is because I've come to understand I can't cure you. No doctor can cure you. I have a podcast called You're the Cure, and the reason I named it that is because I fully, deeply believe and understand that the body's designed beautifully and it will work perfectly, just like a well-engineered vehicle, if you give it what it needs and avoid what it doesn't. If you can give your body the things that God intended for it to have and avoid the things it's not supposed to have, it'll just function properly. I know that sounds too simple. How could cancer and heart disease and autoimmune disease and all these horrible diseases that are all skyrocketing, how could it really just be that simple? But it is. And hopefully by the end of this series, you'll be convinced and you'll understand that. Today, I just want to briefly share my story, my testimony with you of how I got to where I was to where I am now, and really why we're doing this whole Veritas Wellness curriculum. So, I'm a conventionally trained medical doctor. I was born and raised in Central Texas, where both my granddads were general practitioners. They kind of did everything like those old school country doctors used to do. They told me stories of house calls and doing surgeries, amputating people's legs, cutting their appendix out, delivering babies at people's homes. My granddad tells me about one baby he delivered. He went out to this home out in the country, and it was a hot summer Texas night, and he got into that bedroom where the mom was on the bed about to deliver this baby, and the window was open to let fresh air in, and he had just laid out his sterile OB pack of tools, and a chicken flew through the window and landed right in that sterile pack. So I'm talking old school country doctors, and they were great men, and they were great pillars of the community. And I watched these guys, and I lived in this town where they were both the doctors for the town. And so growing up, I felt like what a doctor was someone who could treat anything, could treat the whole family from birth till nursing home and grave and everything in between. And it was just a really neat thing to see my two granddads impact so many lives. So that's what I wanted to do. I wanted to help people, and I wanted to be like my granddads. So I went to Baylor University undergrad, and actually in undergrad, I kind of started getting cold feet because I started doing the math. How many years it was going to take to go through med school and internship and residency and all the debt, and I'd be 30-something years old before I actually got to be in real life working. And so I changed my major 5 or 6 times trying to find something else that could satisfy my calling, but nothing could. So ended up giving in to that call. And I went to medical school at UT Houston. I graduated in 2002. UT Houston's an amazing school, the Texas Medical Center. It's multi-acre place with 2 medical schools, actually, a dental school, a nursing school, a pharmacy school, MD Anderson, Herman Hospital. It's an amazing place to learn modern medicine. And I graduated from there in 2002 and went to Waco Family Practice. And the reason I went to Waco is because they trained family practitioners to do it all, basically, to go be a small town, rural country doctor like my granddad's. So do the colonoscopies, deliver the babies, do minor surgeries, stuff like that. I was chief resident in Waco and graduated there in 2005. My wife and I looked at multiple small towns all throughout West and Northwest Texas, and we landed on one, Post, Texas, CW Post, actually from Post Toasties, the cereal magnate giant, the Post family. They founded that town. It has a lot of history, and it was a great town to start my first practice, the Garza County Health Clinic. And so we started raising the family, having kids, living the dream, small town country doctor, Friday night football game team doctor, house calls, nursing home, county jail, juvenile detention center, do it all. I was the only doctor in the county. And I was loving it because I was living that dream, fulfilling what I thought was my life's destiny. And raising my kids in a small town, everything's going great. Even the county was real happy. It was a county health clinic, and it had been losing money every year before we came. And with the great support staff and nurse and all the community support, we were able to turn that thing around and start making money for the clinic. Became self-sufficient to the tune of $1 million in the bank. The county was collecting the healthcare taxes, but the clinic itself was efficient and not needing that subsidy. So the bank account grew for the county tax payers, which was great. They were real happy. I'm so happy they built us a brand new clinic. State-of-the-art clinic, digital x-ray, new lab. It was awesome. So now I've got a brand new clinic, and that $1 million clinic was paid for in a year. And a year after that, $1 million was back in the bank. The savings account just kept growing, primarily because we were successful. I put successful in quotes because a successful clinic in this day and age means you make money. Your doors stay open, especially in a small town. Medicaid and Medicare is pretty pervasive in rural America, and they don't pay well. So if you have payers who are paying you just a little bit, the way to be successful financially is to see more of those people. So it's all volume. It's a total volume game. I learned how to see a patient every 7 minutes, and that's the average primary care visit, 7-minute visits. They actually taught us in school how to make the patient feel like you were in the room for 15 minutes when you were only in there for 7. Make good eye contact, pat them on the knee, don't look at your computer too much. Techniques to make the patient feel like you weren't super busy and running them through like cattle. So I had that down to an art, and I was really good at just volume and writing prescriptions and getting the next patient through. So that's the setup. Very successful because of volume. So successful, Texas Monthly came and did an article on us. That's a magazine. And then the Washington Post saw that article, and they came and spent a week with us in Post and put us on the front page of the Washington Post newspaper. And then a TV station called and wanted to do a reality TV show, which we decided not to do that. And I'm not trying to toot my own horn here. What I'm trying to do is paint this picture of I'm living my dream, following my granddad's footsteps, raising my family in a small town, $1 million in the bank for the county taxpayers, so they're happy. Brand new clinic that's paid for. Front page of the Washington Post. Fame, fortune, everybody's happy. Everybody's living it up, living the dream. But one small problem is the patients weren't getting better. What I mean by that is I was a highly trained physician. I was chief resident of my class. I knew what I was doing. I was writing the right prescriptions. If someone had high blood pressure, boom, I knew what to do. Hydrochlorothiazide, lisinopril, a beta blocker. If they had diabetes, metformin. If they had reflux, Nexium. I knew the drug to give, and I was given that. The problem was the Nexium, it would work for a little while, but a year or two later, the patient would come back because they'd start having heartburn even though they were on the Nexium. Or their blood sugar would, over time, in a year or two, would start to rise, even though they were still on their diabetes pill. And I'd have to give them more. Their blood pressure would rise even though they were on their pill. I'd have to give them more. I was constantly giving more and more medication, higher and higher doses, double and triple therapies. Nobody got well. No one got off medications. No one reversed any of these diseases. And I was seeing diseases start at younger and younger ages. I diagnosed a 7-year-old with type 2 adult diabetes at 7 years old. I would do the sports physicals every summer for the school. So I could watch these kids over every year. I could track them. Their weight was going up, their blood pressure's going up, allergies, just all these problems in kids. Chronic disease. 40% of kids today have a chronic disease. Back when I was in school in the early 80s, it was 4% of kids had a chronic disease. 60% of adults have a chronic disease. So as I started looking into this more and more, it turns out these disease rates all started to climb post-World War II. Pre-World War II, we're the healthiest group in the world. Post-World War II, it started to decline to the point now, 70 years into this, 80 years into this, we're the sickest country of all the industrialized countries by just about any parameter that you can measure. Here's some slides I've pulled for you just to give you a taste of some of this. These are the latest cancer statistics from 2015, 2016. And as you can see, 1 out of 2 men and 1 out of 2.4 women born after 1960 will have cancer in their lifetime. 1 out of 2. That used to be about 1 out of 20 at the turn of the century. There's been no real change in survival rates of cancer since 1950. The war on cancer was declared in the early 1970s by President Nixon. And we've spent billions and billions, if not trillions of dollars on this war on cancer, and we've really not impacted cancer survival rates at all. And by 2030, the cancer rates are expected to double. Here we see diabetes quadrupled from 1981 to 2011. This slide, we see Alzheimer's predicted rates from 5 million up to 13.5 million. And this is an old slide. That projection's actually gone up. Here's autoimmune diseases. So autoimmune diseases are when your own immune system turns on itself. It starts fighting your own tissues. Multiple sclerosis, Crohn's, type 1 diabetes, and asthma. 1960s all the way to the 2000s, you see each decade these diseases escalate. This next slide talks about kids. This was put out by the CDC. Kids born after the year 2000 will be the first generation of kids since the American Revolution that will not outlive their parents' lifespan. So every generation, the lifespan increased until recently, and it's going down now. So your kids are going to die younger than you will die. This slide shows an autism prevalence on the rise. The first published study or published case, first known case in the published literature of autism was in the 1930s. I believe it was 1934. There was one published study, published case report. When I was born in the mid-1970s, it was 1 in 5,000. As you can see on this slide, the hockey stick. Whenever you see a hockey stick curve like this, where there's a huge exponential rise, you can rest assured it's not genetic. There's something outside the genes, because genes don't change this fast. Genes don't change in 30 years. 1 in 110 was the 2009 statistic on this graph. The latest numbers are more like 1 in 38, 1 in 48, depending on what numbers you're looking at in 2018. This next slide talks about life expectancy, ranked number 26 of all the industrialized countries. That's dead last, and our infant mortality rates are the highest. This next slide, the point of it is, these are things that we do: MRI exams, CAT scans, tonsillectomies, coronary bypass surgery, knee replacements, cesarean sections. These are procedures, things that doctors can do with their hands to you, and we're in the top 1, 2, or 3 of most of these categories compared to the rest of the world. This next slide shows average number of prescription drugs taken regularly, age 18 and older, and as you can see, compared to other countries, we lead the pack. This next slide breaks down drug usage by age group: kids age 0 to 11, teenagers, young Americans age 20 to 59, and then folks over age 60. And you can see the color codes. Dark blue means they're taking 1 drug, green is 2 drugs, the light blue is 3 to 4 drugs, and the light green is 5 or more drugs. And it's incredible the percentage of our population that's on at least 1 drug, but even 5 or more drugs. And pretty much over age 50, if you're not on a drug, something's wrong with you, according to this slide and the normal standard for a standard American. This is to show the money that we spend. Obviously, we far outspend everyone else when it comes to dollars, healthcare dollars. And I do want to just throw in a little bit on insurance. Here's employer health insurance premiums that are rising since 1999. And the part that you're paying, it also continues to rise, as you can see in this slide. There's a reason for all this. There's a reason these disease rates have risen like a hockey stick curve exponentially. There's a reason you're paying way more out of pocket and your employer's paying more out of their pocket. There's a reason we went from first to dead last. And the reason is, it's not your genes. The reason is, it's lifestyle and diet. As this slide here shows, talks about cancer, and it says only 5 to 10% of all cancer can be rooted in genes or related to genetics. The rest of it, 95%, has its roots in diet and lifestyle. Cancer's your number 2 killer, about to be number 1. Here's a slide on heart disease. This particular study says 80% of heart disease, totally preventable. It's diet and lifestyle. It's not your cholesterol. It's not eating fat. It's inflammation. Inflammation is diet and lifestyle. And I could go through more and more studies that point to diet and lifestyle as being the root cause of all this chronic disease escalation that we're seeing. So that's really the point of Veritas Wellness. The way to fix you and the way to prevent you from being one of these statistics: 1 out of 2 having cancer, Alzheimer's, the heart disease, the epidemic of chronic disease. You don't have to be a part of any of that. And you don't have to worry about the insurance and Medicare and the bankruptcies that are induced by all this healthcare chaos. The best way to not have to worry about Medicare and the funding and the financial part is not need the system. And you shouldn't need the system. You shouldn't need a doctor. If all the disease is caused by diet and lifestyle, then that's what you need to focus on. And your doctor, unfortunately, doesn't have any understanding of diet and lifestyle because he wasn't trained in that. Somewhere along the way, someone decided for you that you just aren't going to deal with or work on your diet and lifestyle. So therefore, the only other option is to medicate you and treat your symptom. Well, that's why I'm here to inform you that that doesn't have to be the case. You can deal with your diet and lifestyle. It is the root cause of your disease. And as Dr. Mark Hyman said at the Institute of Functional Medicine at Cleveland Clinic, 20 years from now, all doctors will practice this way, meaning getting to the root cause of the disease, getting to the root cause of the inflammation. That's what functional medicine does. Edison at the turn of the century said basically the same thing. The doctor of the future will give no medication, but will interest his patient in the cause of disease and in diet and in movement and lifestyle. Hippocrates said it 2,000 years ago. All disease begins in the gut. He had a notion and an understanding that diet mattered, gut health mattered. There's a root cause to this stuff. So if this is all new to you, that's good. It's new to most of us. It was new to me. I didn't understand any of this, but now I do, and I want to share it with you. I want to leave you today with this Mark Twain quote. It ain't what you don't know that gets you in trouble. It's what you know for sure that just ain't so. And I want to give you a little bit of a preview. Some of the things that I thought I knew for sure that just ain't so. Heartburn is from too much stomach acid. It just ain't so. Stents and bypass surgery reduce the risk of future heart attack and death. It just ain't so. Type 2 diabetes is a chronic, progressive, irreversible disease. It just ain't so. Cancer is only reversible with chemo, radiation, and surgery. That'll be a future class. It just ain't so. Genes are the root cause of disease, and the U.S. healthcare system is the best in the world. None of that's true. I didn't know that, but now I do. We'll go through the details of that and much more in the classes to come. So, you are the cure, but you got to be educated, you got to be informed. Informed consent is what a doctor should get from you before he does anything to you. That means you need to be fully informed so you can give your consent for that doctor to do X, Y, or Z. The problem with our healthcare system is the doctors aren't even informed, so they can't inform you, so you can't give informed consent. So, in a nutshell, this video series and these classes are to fully inform you, and then you can decide which of the three options do you want to do. Do nothing and suffer. Treat a symptom with a pharmaceutical or a green version of pharmaceuticals, which would be a vitamin or supplement, or get to the root of it. Option 3, get to the root of it and fix it. You need to be informed that you have these three options, not just two, and then you can decide what you want to do. And hopefully you'll make the decision for the third option. That's what I'm passionate about, and that's why we're here to help you, educate you, and then support you and walk you through how to become a not standard American health statistic. So again, welcome. Thanks for checking us out, and we'll see you in the next class. So if this is all new to you and this is kind of shocking, good. You need to be shocked. Wake up, America.